Because we aren't getting as many N95 masks in as much as we are using them, we have gone to a reprocessing strategy to make sure that we can keep up with our masks and take care of these patients. After those units are done using those N95 masks, they are collected and then they are taken to a processing area and then gone through a sterilization process. The second one is something called BioQuell. BioQuell is a hydrogen peroxide machine. And then lastly is UV, and so UV germ decontamination. And so the way that works is that we've measured the room that we're using for UV, and our healthcare providers will go in, place them in there, and then it is run for a particular period of time, and then our healthcare workers can pick this up when they're done. All of these processes decontaminate or sterilize the masks, and there's no coronavirus on them. The biggest concern that we have is to make sure that the mask still works as a respirator, and so that's where we're being very careful to make sure that the mask still can fit to the face, and we can continue to use those.